They told you it's genetic. They told you it's just aging. And some even told you, once you're diabetic for life. But what if I told you that's not entirely true? Let's start with a cold, uncomfortable truth. The modern medical system is built to manage your symptoms, not reverse your condition. Especially when it comes to high blood sugar. But blood sugar isn't a disease. It's a warning light. And ignoring it or just masking it with meds is like taking the battery out of a fire alarm and pretending the fire isn't there. So today, we're going to strip away the noise, the myths, the sweet lies wrapped in pharmaceutical packaging, and show you how to take back control of your blood sugar. Let's begin with this question. What really causes high blood sugar? It's not just sugar. Yes, sugar plays a role, but sugar is only the visible tip of the iceberg. Here's what no one talks about. High blood sugar is a metabolic communication failure. Your body is trying to talk to you, and we've trained ourselves to ignore the language. Your cells need energy. They rely on glucose. But when the system is overloaded, too many refined carbs, too much insulin, too little muscle, too much stress, your cells stop listening. This is insulin resistance. It's like trying to shout through a wall. The body keeps producing more insulin, louder and louder, and your blood sugar stays high. Now here is the shocking part. You can have normal fasting blood sugar and still be on the road to disaster. The real early warning sign is elevated insulin, not elevated sugar. And doctors almost never test for insulin. Why? Because there's no insurance code for you're on your way to pre-diabetes. But here's the empowering part. You don't need to wait for a diagnosis to take action. So how do you really lower your blood sugar? Not temporarily, not just for the lab test, but in a way that rewires your metabolism. Let's break it down. 1. Stop grazing. Start fasting, eating 5 to 6 times a day, snacking between meals. It's the worst advice ever given to humans. Every time you eat, especially carbs, your insulin spikes. When insulin is up, your body is in storage mode. No fat burning, no blood sugar drop. Just storing and storing. Fasting flips the switch. Try this. Compress your eating window. Start with 12-12, then shift to 16-8. Want faster results? Go OMAD. 1 meal a day occasionally. Fasting isn't starvation. It's structured rest. It allows insulin levels to drop, which opens the door for your cells to become insulin sensitive again. 2. Walk after every meal. Forget the gym. Forget the treadmill. Want the simplest, most effective blood sugar hack? Walk for just 10 to 15 minutes after you eat. Why? Because movement activates muscle glucose uptake independent of insulin. That means your muscles are literally sucking glucose out of your bloodstream without needing insulin's help. This single habit can flatten post-meal blood sugar spikes and reduce overall glucose exposure throughout the day. No supplements, no gimmicks, just human biology used wisely. 3. Kill the carbs. Strategically, not all carbs are evil, but refined carbs, white flour, sugar, processed grains, they hit your bloodstream like a freight train. Your pancreas panics, insulin floods in, and what doesn't get used is stored as fat, and the solution isn't keto for life. It's carb timing. Want carbs? Earn them. Eat them after workouts or at your most insulin-sensitive time. The evening meal. Surprised? Yes, your body actually handles carbs better at night for most people. And prioritize slow carbs. Lentils, sweet potatoes, quinoa. Paired with fats and fiber, these release glucose slowly, giving your body a chance to manage them without chaos. 4. Fix your sleep or forget everything else. One night of poor sleep can cause insulin resistance the next day. Yes, just one night. Sleep is your metabolic reset button. Poor sleep raises cortisol. Cortisol raises blood sugar. Now combine that with breakfast cereals and morning stress, and you've already lost the day. Protect your sleep like your life depends on it, because it does. Dark room, cool temperature. Zero screens 90 minutes before bed. Magnesium glycinate. Wind down rituals. No exceptions. 5. Build muscle, not just for looks. Muscle is your metabolic armor. It's the largest site of glucose disposal. More muscle equals more places for sugar to go. Less muscle equals more sugar stuck in your blood, wreaking havoc. And yet, people still focus on cardio when trying to burn off sugar. Cardio has its place, but muscle building is what changes your baseline. No gym? No problem. Squats, push-ups, resistance bands, body weight circuits, 2 to 3 sessions a week. That's all it takes to rewire your insulin sensitivity at the root.